I have a slide here to show us the possible treatments. Of course, treatments depend on the extent of the disease. But in this slide, you have a whole range of treatments. Fortunately for prostate cancer, almost 85% of patients who are elderly, they may have some form of low-grade or slow-growing cancer, and only about 15% have very advanced, aggressive cancers that need to be treated. So there are a whole majority of cancer patients with prostate who are believed not to require treatment because they have a very slow-growing or indolent tumors. And they don't even know that they have prostate cancer. So only 15% of men have aggressive forms of prostate cancer, and those 15% of men will require some form of treatment to be done. But there are a whole range of treatments that are available worldwide. There are men who have early prostate and very slow growing. We just follow them up. We don't need to treat them. There are, however, some men where the prostate is aggressive and they need to be treated. So we have options of surgery, we have options of hormonal treatment where we control the prostate by denying the cancer. The hormone, prostate cancer is one of those hormonal-driven cancers. The androgen hormones in a man drive the prostate to grow very quickly. So sometimes removing the gonads or the testes, as I was showing you in the previous picture, does the trick. The cancer stops to grow. There are a couple of immunotherapies like Provenge. These are newer treatments, not available here, very expensive treatments these are. Sometimes we have chemotherapy for patients who have advanced disease, and radiation as well for patients who have advanced disease. You should remember that these treatments can be given in sequence, one after another, or they can be given singly, alone, or they can be given in doublets, as in 2 treatments given in combination. So these decisions of which treatments all depend on the stage of the disease. So is it possible to prevent prostate cancer using diet? So generally speaking, it is possible to control some diseases using diet. And indeed, diet, eating well, is a very important part of fighting disease generally, and especially non-communicable diseases, which include cancer, include heart disease and diabetes. So diet is very important, and diet modification is very important. Generally speaking, in cancer or in oncology, we talk about a plant-based diet as being the best. So plenty of fruits and plenty of vegetables, exercise regularly exercising, keeping a lean body, avoiding things like alcohol, smoking, and other toxins and infections can ensure that you have a healthy life. And once you have a healthy life, you will avoid many of these non-communicable diseases that are due to lifestyle changes, obesity, including alcohol, smoking, and all these other risk factors. So generally speaking, that is one way we can prevent cancer. You need to make sure you're eating plenty of fruits and vegetables. The recommendation is every meal should have a fruit, should have a vegetable. Is it breakfast? Is it lunch? Is it dinner? Make sure you have a fruit besides to ensure that you detoxify your body. Exercises help to improve blood circulation, but they also help your lung, your circulation, your diet, your metabolism, energy to the muscles, and in that way you can keep off a lot of diseases, including cancer. Alcohol, when you take lots of alcohol, your risk of cancer definitely increases. The same thing with smoking. Smoking is a highly it's a high risk factor for cancer. There are about 11 cancers that are associated to smoking, including lung cancer, bladder cancer, kidney cancer, breast cancer, cervical cancer, esophageal cancer, cancer of the stomach, and many more cancers. All these can increase when you smoke. You can increase your risk of developing these cancers that I have mentioned. So smoking is a known risk factor for almost 11 different types of cancers. And so keeping away from smoking is one way you can fight cancer. Infections do cause cancer. In Africa and in Uganda, a lot of cancers are caused by infection. A good example is in Uganda, for example. Our number one cancer is cancer of the cervix in terms of numbers. Every year, almost between 4,000 and 5,000 new cases of cancer of the cervix, and probably more because many of our poor people don't even come to hospital. So, and that cervical cancer is caused by a very common infection which is transmitted sexually within our community, and that's the HPV virus. And there is vaccination against this virus, but there's been a slow uptake of vaccination. This virus is very, very dangerous. It does not only cause cervical cancer, but the same virus can cause cancer in the mouth, can cause cancer of the penis, can cause cancer of the vulva, can cause cancer of the anal area, and cancer of the mouth. So you can imagine one virus, which is preventable, can cause cancers in all these places that I've mentioned. So these are dangerous viruses. However, there is a vaccine against this virus. So cervical cancer is by and large causing a huge burden of cancer in our country. And if we just took on vaccinating our young girls, we should be able to fight this. In other countries, they're vaccinating young boys as well, because in other countries they practice homosexuality, and that also puts a risk of anal cancers among young boys. So in Uganda we don't have that much problem, but that is one big factor that we could get rid of. Once we get rid of this virus, we get rid of a huge number of patients that are burdening our healthcare system. So if you have a young girl at your home, please do embrace the government program of cervical cancer vaccination. The other thing that I should emphasize is that knowledge is very powerful. Because of lack of knowledge, many of our patients, the typical patient that we see in Uganda is a patient who has symptoms for over 6 months, over 1 to 2 years, and never comes to hospital to seek any care. Until when this huge mass is now causing pain and they are unable to work or they are unable to feed, that is when they come to hospital. And why is this so? Because of lack of knowledge. For us to be able to fight cancer, people must be knowledgeable. People must know about the symptoms of cancer, the screening tests that they can do. They must know that these painless masses that come, affect their bodies can eventually become incurable. But there's also a chance to cure them if the patients are seen early. So knowledge about cancer is a very important factor. Generally the uptake is slow, but it's improving by the day. We are beginning to see a few early cases of cancer. But we think that as we continue to improve our campaign against cancer, we should be able to impart knowledge among our people. A few things that you must know as I conclude: should you see any part of your body with blood from any part, it's not normal. You're not supposed to have blood coming from your breast, coming from your private parts, coming from, when you go to the toilet to pass stool. There should not be any blood. You should not be vomiting blood or coming from your mouth. Blood is a bad sign, and sometimes it can be a sign of cancer. So when you see any bleeding anywhere, please report to a doctor as soon as possible. so that they find out the cause, because that is one of the things that can be a sign of cancer. The other thing is masses, painless masses. Is it the breast? Is it any part of your body? Please make sure you see a doctor as soon as possible. Any weight loss, which is unexplained weight loss, can be a sign of cancer. Fevers, infections can also be a sign of cancer. Inability to swallow can be a sign of cancer. Inability to pass stool, constipation can be a sign of cancer. So all these and many other signs can be dangerous, and please do come as soon as possible should you have any of these many things that I've mentioned. Thank you.